briefly, to start off, I did my Bachelor of Nursing Sciences at the University of Pretoria in South Africa. It's a 4-year degree. In our 4th year, we do a research proposal. So we essentially understand that we graduate with honors. After that, because I had an interest in emergency nursing, I did a couple of emergency specialized courses, so additional courses over and above my education, of which those are advanced cardiac life support, pediatric advanced life support, and neonatal resuscitation, which all obviously benefit in the area of emergency nursing. And then apart from that, we've done a couple of extra courses within practice while I've been working. To name a few, casting and splinting, some ECG analysis and interpretation courses. And on the island, we've currently done a disaster preparedness course, which is also quite interesting. And that aside, I've also applied with the New Zealand Nursing Council. So I am in the process of getting my annual practicing certificate sorted with them. And then essentially I am qualified to work in New Zealand as well. So the first page, I would say, is all the external pictures or shots of my career up until now. And obviously in the top left-hand corner, it started at the very beginning where I was working for a huge government hospital in South Africa. We did a little bit of spare time at Tshwane District Hospital as well, which is a smaller district area hospital that caters for smaller emergencies. I then obviously moved my way through the medical practice just to the right of Tshwane District Hospital. And that was our little ER setup that we had. So although we were dealing with general practice patients, so your day-to-day cold, flu, bronchitis, that kind of thing, we were still able to help patients that needed critical care. And we did so a few times there. I actually myself had to rush a pediatric patient that had come in with severe respiratory distress to one of our nearby hospitals. We had to call an ambulance to actually assist us for that. But before I digress too much, just to the right of that is the general surgeon's rooms that I worked for. And again, you can see at the bottom, a lot of emergency areas. Further down to the left in the page was the small amount of time that I spent working in Dubai, our emergency area there. Very big, glamorous hospital, fantastic equipment as well, but constant flow of patients in and out. And because we had patients paying big money, they were private patients, they had their own ideas for what kind of medical attention they were coming to get. So they would dictate to us what kind of care they were needing. Moving to the right of that, obviously the bottom right-hand corner is St. Helena Island. Very small, it almost looks like a house, but that just depicts the closeness of the island community as well. Everybody is essentially at home there. So no matter who you are, where you're from, you belong to the household that is St. Helena Island. And it was a very big highlight in my career to become a part of the family there. You'll see at the bottom right is our 2 ambulances that we were working on St. Helena Island. We had one which we call the bush ambulance, which we'd have to take 4-wheel driving into the mountains because the big ambulance wouldn't be able to get in or out of certain places on the island. Which paints quite a picture of the experiences that we got on the emergency service rigs there. And then just left of that is where I am currently, the beautiful, sunny, windy island of Cayman Brac. We also, same as St. Helena Island, we're a small family, we're very busy. And not only do I work in the emergency unit here, but because we're a small island and we cater for so many things, I'm often expected to work on the ward as well. And as you can see at the bottom on the ambulance too. So I go out in the community on Cayman Brac as well, and we collect patients from their homes. We assess them there. We see if they need hospital care. So if they do, we've got to load them up and bring them in. I actually had a patient the other day that I had received the 911 call for. She'd obviously needed emergency care, so we put her onto the ambulance. We brought her to the hospital. I did all the emergency care intervention, then moved her from there to our radiology department to get her radiology, obviously her orders sorted out there. then moved her onto the ward, did her ward care for her as well, and transferred her to Grand Cayman too. So I've walked the path from the very beginning 911 call right until essentially her discharge date. So it's not something that you'd ordinarily have at any given hospital. It's really a fantastic experience here.
I see so many things in these photos: high end, low end, large scale, small scale, equipment that is plenty, equipment that is few, the ability to go out into the bush, or the requirement to stay fully in the area of the American hospital in Dubai, for example. A really strong set of diversity that you've got, probably uncommonly strong diversity. You had a lot of bosses in your life. If we were to accumulate all of your strengths from what your bosses tell about working with you, what would that list be like?
About my strength, I think one of the things that would probably stand out is the fact that I would consider myself an A-type personality. And I think a lot of my previous bosses and my current boss would probably say that I am an A-type personality. So I enjoy chaos, but I enjoy structured chaos to the best of its ability if it's possible. I am a solid worker as well. I have a solid work ethic. I enjoy being on a team and being a team player. So I think that is one of my driving characteristics. I'm always trying to help out and be reliable as possible and to assist my colleagues and my team wherever I can. A lot of people would probably say that I'm quite self-confident as well. So I don't mind challenging orders, and I don't mean that in a negative way, but I would be quite prepared to stand up for myself or to advocate for my patients or to advocate for my team. I ask a lot of questions. Again, that comes from my need to learn. So I question a lot of things. I am essentially, I would say, a good communicator because I try my best to make sure that whatever I'm trying to say or do comes across and is understood by the next person. And out of that comes my ability to network and collaborate. And I think that's why I thrive in an emergency area or an ideal emergency area. Because I like working with a team of people. I like networking. I like collaborating and working together towards a common goal.